Hey guys, so what I want to take a few minutes to talk to you about today is, or right now, is direct versus indirect attachment, okay? In the last unit, we talked about how ligaments attach bone to bone, and we have discussed the fact that tendons attach muscle to bone, which is true most of the time. So let's talk about indirect attachment first, because indirect attachment uses tendons, which we've talked about. In indirect attachment, and I am going to show you a picture. In indirect attachment, what we have happening is we have a muscle, and the muscle stops short of the bone. So here's the muscle, here's the bone. So there's this gap. How do we fill this gap? We fill this gap with the tendon. Let's look at a picture. Let me show you a picture. Oh. Okay, so that's gonna be hard to see. Let's do it this way. So you see here, this is one of your biceps brachii. Okay, biceps biceps brachii, and you can see muscle starts here, muscle goes to here, big gap before it hits the bone down here. So what do we fill that gap with? We fill that gap with a tendon, okay? So that is indirect attachment. Direct attachment then is different. Some muscles, and again, I'll show you a picture of this. Some muscles there's so little space between the muscle and the bone that instead of having to have a tendon like we normally think of it, instead we have these microscopic collagen fibers. And those microscopic collagen fibers are going to fill in that tiny gap, if you even want to call it that, between the bone and the muscle. It's literally microscopic though. So let's look at a picture of that one. For that, we're going to take a look at over here. We're going to take a look at the lateral head of the triceps. And if you look all the way down here, it's connected to the bone way down here, but it's literally connected to the bone with almost nothing. And same thing with this muscle right here, the brachialis. You can come all the way down and you can see there's just that tiny little bit of collagen. It really isn't a tendon. You can't even see it on this one because that's how microscopic it is. So indirect attachment, not microscopic, clear gap to fill between the muscle and the bone. How do we fill it? We fill it with a tendon. Direct attachment, there isn't enough of a gap between the muscle and the bone to fill it with a tendon. So instead what we have is we have microscopic collagen fibers that allow for that attachment. So that is direct versus indirect attachment. If you have questions, let me know. See ya.